All right, so we're here with Dr. Yenigun, who is an emergency department doctor. Now, you guys always say ED, and then as a urologist, yes. I always think, well, you specialize in Viagra or something, but no, this is ED
That's good.
emergency department. So,
yes.
So first, what got you all excited to be in the emergency room all times of the day for your career?
Sure, that's a great question. I think one thing I really love about it is how unpredictable it is. You know, we never know what's coming, you never know what to expect, so it really keeps things lively, it keeps us on our toes. I also like that we get to see a variety of pathology. You know, we can see literally anything. Babies with meningitis, old people with COPD exacerbations, it could be anything. And I really love having that breadth of knowledge. And the other thing is that we really get to be there for people during some of their darkest and most challenging times.
So in the drive for men's health, what we're trying to avoid is people have to there's still going to be a role for emergency medicine, but sure. A lot of what you see is probably very easily preventable. And we feel like guys are probably the ones that wait the longest. So would you say that's what your experience has been as well?
I would have to agree. I would say I do see that a lot, you know, men coming in with things that could have been prevented, and they just wait too long. And I don't know if sometimes it's pride, but often other times they have challenges and barriers such as, you know, having to work and make the money for the home, and they don't want to take time off. So there's often barriers to it, but I feel like, you know, making an effort to come in and get evaluated can really help in the long run. I mean, you think you don't want to miss a day of work, but if you get a really bad infection and you end up hospitalized for 2 weeks, that's even worse.
Yeah, so you were talking earlier about chest pain and patients that come with the heart attacks. Heart disease is one of the biggest killers of men, you know, out there. So when they come and see you in the ER, like, what is it like for them? Like, what are they feeling? Because I'm trying to basically like scare them into knowing that you want to avoid that as best you can.
Sure. You know, a lot of times people have chest pain. It's usually worse when they're walking. They'll start noticing, yeah, I've been having this for a couple months. You know, at first it was just when I was running on the treadmill, and then I started noticing it when I was walking around, and then today I was just sitting on the sofa, and suddenly I got this crushing chest pain. I had trouble breathing. I got sweaty, and then that's when they come in. But, you know, they've noticed a change for a couple months. You know, for a couple months I've been feeling pain when I'm running. But sometimes people think, oh, maybe I just got a cold, or maybe it's just a muscle ache. And so sometimes people take time. But, you know, time can be tissue, and time can be heart.
Yeah. So I get chest pain when my call pager goes off. and usually now, like on the thing, it says exactly what the ER doctor is calling me for. And I get chest pain when it says foreign body. So I'm sure you've seen some interesting foreign bodies.
I have.
Urologically, I've seen anything from BB gun pellets in the urethra to coat
Ouch.
hanger pieces to seam rippers.
I don't want to ask how they got there.
But you probably see some interesting, you know, foreign bodies as well.
I do. Yeah. I see things in places they shouldn't be.
Yeah.
Definitely. I've seen a BB in the eye. Seen a little kid that aspirated a dinosaur, little toy dinosaur, so that had to come out of the lungs. Food getting impacted in the esophagus, and then a lot of things, you know, rectally that shouldn't be up there.
So those are all avoidable things, just as
Definitely.
you mentioned, even having to come in for the chest pain is avoidable. And a lot of those avoidable things are risk factors that they're engaging in on a day-to-day basis. So some of the things we've seen are high-risk things like lots of drinking, smoking, eating crappy food, to not exercising. So if you had three tips for how to avoid seeing you in the emergency room for guys out there, what would they be?
I think one would be to exercise, you know, maintain a healthy lifestyle. It's really crucial to health. Another thing is...
Do you have a recommendation for how much?
You know, I think at least, you know, 30 minutes, 5 days a week. And it doesn't have to be going to the gym, lifting heavy weights or anything. It could even be just going for a long, brisk walk. Take your dog on a walk.
It doesn't have to be what you do on Instagram, like your muscles.
You've been on my case about my muscles all day.
No, but it's motivational. It's inspirational.
Thank you.
You got to have people that you look up to that motivate you, and that's been for me. But you bring up a great cause. You don't have to be that person.
No.
I think in America we just have to get people started.
I mean, when I was a kid, I was actually quite obese and unhealthy. I had a physician tell my mother that I may not live past my 20s because I was so unhealthy and my cholesterol was through the roof, and I was just in a bad place. But I had to make a conscious decision to change that, and you know, better myself and become healthier so I could move on one day and help other people, because it's really hard to help others when you can't help yourself. So I definitely think exercise is important, and that's been kind of a cornerstone of my life and something I really focus on. Other thing is healthy eating. And the problem is sometimes people don't really understand what good nutrition is, and we have weird things like the food pyramid and then the my plate, and it's really challenging. So really finding a way to find the right resources and focus on eating healthy decisions. I personally eat higher protein, lower carb. That's what works for me. But yeah.
No, I agree with you. I mean, I use a thing called MyFitnessPal.
Yeah.
And I kind of track my
Log
calories.
it all.
And if there's something I want to eat, like dessert at night, I have to kind of check. And I do cheat quite often, I'm not going to lie. But you know, it helps me kind of have a balance about, my diet. So get moving, exercise, eat better. Number 3.
Get your checkups. Go see the doctor. Don't hold off. Don't think, oh, I'll be fine. I'll be fine. Personal anecdote. I was visiting my uncle in Maryland, and we were watching a soccer game. And he just looked uncomfortable. And I said, what's going on? You don't look good. He was like, my chest hurts a little bit. And I said, really? Has this been happening? He's like, yeah, it's been happening for the last few months when I go on walks and everything, but it's fine. I'll be okay. I said, you haven't seen your doctor? He said, no, I'm tough. I've got this. That night I made him go to the hospital, to the emergency department. And they actually cathed him, and he had 99% stenosis of his LAD. So that's a big clot in the heart, which could have ended up in a bad heart attack at any time. So definitely just get checked out. If there's something wrong, go see a doctor. It doesn't take that much time out of your day, and it can prevent something catastrophic.
Yeah, and the benefit we have here in the States is that a doctor is available in a matter of seconds. So you can now do teleconferencing. Yeah. There's an emergency room in almost every single place out there in America. So those doctors are always there. And then there's always your primary care physician. So the big excuse, I don't have time to go or I can't get an appointment, is a bunch of crap.
We don't have that anymore. Yeah. My name is Dr. OnurYenigun, and it's time to drive for men's health.